And now, without further ado, I hope it is my pleasure to welcome our first speaker, the extraordinary Associate Professor Kate Mulligan. Kate is the Scientific Director of I've forgotten exactly what it's titled, and I can't see the Zoom presenter slides, but the Institute for Social Prescribing in Ontario and affiliated with the University of Toronto. Kate, for anybody who's been in social prescribing circles, has spoken in Australia before, particularly at the Aspire conference, and is coming to us from Arts Healing Week in New York, which has been extremely busy time for the NYU Jameel WHO Arts and Health Centre. Kate, are you able to unmute and can you join us?
I'm here. Thanks, Claire. And hi, everyone. Can you hear me?
Everyone can hear you beautifully. Thank you.
Hi, everyone. I really wish I could be there in the room with you. My name is Kate. As Claire mentioned, I am a social prescribing enthusiast from Canada. And yes, I'm actually in New York City this week for the United Nations General Assembly's Healing Arts Week, which has been very busy and very thrilling week involving things like the launch of the WHO and Jameel Arts and Health Lab's Lancet photo essay all about arts and health, conferences, events, and many, many things showing huge momentum for arts and health here in the United States. And at the same time, it is a very challenging time to be here in the US and to be a neighbor to the US and to really think about what it means to be in relationship and to be a good neighbor at a time of real strain and stress here for many, many people and communities. This is traditionally Lenape territory, but land acknowledgements aren't a thing really here in the United States. I come from Toronto, Canada, not too far from here, where they are a thing. So I come from Treaty 13 territory, the home of the Mississaugas of the New Credit, traditional territory of Haudenosaunee, Wendat, and Anishinaabe people, and today home to many Indigenous people from across Turtle Island and around the world. And so I felt very welcome with your land acknowledgements and also with your mentions of cups of tea, which are also not really a thing here. So I'm learning that I got to bring my own tea to all my US events. I am here because I was invited by Claire, but also because I want to extend an invitation to you. And that's really a big part of what I do is to encourage people to take their next steps, whatever those might be, when it comes to thinking holistically about health and well-being and building resilient people and communities. So this image here is from a very special place in Toronto. It's a reclaimed space under an expressway that hadn't been used for much. But was in the middle of an area full of condos and people who didn't really have backyards. And it's now something called the Bentway. And I did some work and research with them over the last year or so about social connectedness and arts and place. And one of the things we found in a survey of attendees at the Bentway was that for people to feel well, to feel that they belonged, to feel a sense of connectedness with others, they didn't need much. They needed a place to sit. They needed a bit of greenery, and they needed an invitation. They needed a reason to attend, a little bit of programming, a little bit of outreach, a little bit of something to invite them in. And so I encourage you to have a look at that prescription for social connection online to hear a bit more about that particular project. But really, that sense of invitation and inviting you in underpins much of my work, and I know much of yours. So health happens in relationships. This, I mean, in the most literal way possible. If we're not breathing, exchanging air with our environments, if we're not touching other people, if we're not eating, if we're not excreting, we don't have life. And our definitions of health often overlook this fact. So this is an image in the traditional woodlands style, which is common in Anishinaabe and Cree communities in Canada. And the lines connecting the people, the plants, the nature, the canoe, all of these represent that connection and in different ways, in different forms of energy exchange between ourselves and our environments. We are meant to be in community. We're meant to be with other people. We're meant to be in contact with nature and with ourselves, with our own sense of self and purpose. And this is something that I think, as Claire mentioned very eloquently in the beginning, Indigenous communities and traditional communities around the world and in our own heritages know and have known for a long time. And one of the things we're trying to do in the work of arts and health, and broadly in social prescribing and social approaches to health and well-being, is to help reconnect us with this traditional knowledge and wisdom. So here's a relationship that matters a lot to me. This is my daughter, Orla. She's one of my 3 daughters. And about a year and a half ago, Orla suffered a sudden and life-threatening brain infection. She had to undergo multiple surgeries and was in acute care for many, many months, and in rehabilitation care for another many months. But as you can see, in addition to the life-saving acute care that she received, she also received the thing that really made life worth living again for her, which was time in nature, music. You can see the therapeutic clown in the background, art, right? Those kinds of things that really make us feel that we matter and that we belong. And you can see even her helmet in the second 2 pictures. My husband painted the picture of the wolf on her helmet. She didn't want to wear it at first, who would? But the artwork with her favorite animal made a big difference for her and made her feel welcome in the helmet. And this was a year and a half ago. I'm really happy to say she's continuing to do very, very well. But I wanted to let you know that my own lived experience and my own caregiving experience really reflects and reinforces what I knew intellectually before, that this is health and well-being, that we really can't thrive without both parts of health and healthcare. So I'm a health geographer by training. I'm really interested in people's relationships, as I mentioned, with themselves, with one another, with their neighborhoods. And so that's the lens with which I approach the work that I do in the area of social prescribing. I also have a really long policy background. And so most of what I do is really try to help people like you to grow and systematize your work so that it becomes something that is available to all of us in an equitable way, and that we can keep learning and growing and improving. So this is social prescribing. Most of you know what this is, but just very briefly, it is a little bit of a more formalized approach in which we're able to help people connect to non-clinical supports and services that help their health and well-being. There are 2 things that really make social prescribing different from other approaches. One is that it is a supported referral that is directed and led by the person and the community. So even though we use the word prescribing, and that can be hard for those of us coming from the non-clinical side, we use that as an invitation to the medical side so they understand what it means to have a pathway and a bit of an algorithm for what to follow and how to help people in support. But really, it's all about the person deciding what matters to them and having support, often from a peer or a community health worker or a link worker, to access, to break down barriers to attending, and to the number 2 thing that makes social prescribing unique is evaluation and tracking. So we can finally see in that precision community health way whether this makes a difference, right? What happens to people's health experiences, health outcomes, and use of health services when they are referred and supported to these kinds of non-clinical programs. Really, at the heart of social prescribing is self-determination, right? The ability of people to have a sense of autonomy and decision-making for ourselves, tap back into our competence and our ability to get things done in our own lives and have a little more control over our health and the conditions for our health, to have that sense of relatedness and belonging and mattering in the world, and also to have a sense of beneficence, that ability to give back to others. So when we move over and share a seat at the Bentway, or when we become a volunteer, or when we otherwise give back in small or big ways, regardless of our abilities, that's when we see some of the biggest improvements in health and well-being. We shift our lens from somebody with illness or somebody who feels as though a drain on others to somebody with something to offer, to having positive well-being. My work is really about trying to help with the leadership needed to take that work and grow it and make it part of systems, again, so that we have equitable access and we keep learning and growing together. One of the ways to do this that I think is really important is just by trying it out. I love to tell people, you know what your next step is, give yourself permission to take it. Even if you don't have a lot of the resources that you'd like to have to do this really well, we often can do quite a bit by repurposing what we have already or reaching out to other people for those pieces we don't have. So I often encourage groups to come together. One might have space, one might have access to groups who really could benefit from services or have community strength to offer. Another one might have programming that they can share, dance classes or artwork or that sort of thing. So starting small, starting wherever you can, and then using feedback loops to learn and to grow, right? So a reinforcing loop that helps you grow, and this happens a lot in arts prescribing, social prescribing, arts and health. It feels good. You want to do more of it. You want to continue and you want to keep learning. Likewise, you might have a balancing loop where you learn something doesn't feel right. It isn't working, and we need to back off or try something new. But we don't really know this without trying it out. So sometimes in the work of social prescribing that I do, particularly because I have a background in policy and public health, people might say to me, and do say to me, this is nice, but we need to do big structural systemic change. This isn't going to address all of the needs and social determinants of health that people have. But that's not always how change happens. And that's not even always how policy change happens. So policy change happens often in dialogue with what's happening in practice and in communities. We're trying it out, we're growing, we're showing policymakers what works, we're demonstrating where we need more investment, and then we're in that dialogue together, starting off with a big old-fashioned mechanistic approach from the top down isn't always the right strategy, right? And we see this in the UK where they jumped to social prescribing, which I'm a big fan of, but it was hard in some places, right? Places where there was already a strong culture of co-production and community, it worked really well. Places without that struggled to figure out how to make this work in a safe and effective way. The number one thing that I hope you walk away from this morning with is to start with what's strong. That means not just amongst the people you work with or even inside yourself, but where there's readiness, where there are champions, where you think there might be likelihood of success. And again, you're going to use those feedback loops to keep learning and to keep growing and to move in directions that are meaningful to the people and the communities that you are working with. Often when we work in health equity, we want to start with where we think there are the biggest challenges. And that's really important work. That's really important work, especially for crisis workers, for policy workers, for clinicians, and so on. For social prescribing and for arts and health more broadly, it's often best to start with where there's opportunity and then show the benefits and continue to grow from there. And that's what's really working here in the US, where suddenly we're starting to see major funders, major governments, and so on take an interest. So start with what's strong and do that part next. I teach public health advocacy to doctorate in public health students who are mid-career professionals who want to be leaders. This is something I use a lot with them. I talk with them through this model of 6 conditions of systems change. So at the top, you can see that structural part that people are very interested in, sometimes feel very sophisticated if they talk about we need to change policies, practices, and resource flows. That's the explicit part of structural change, and yeah, it is important. In academia, those of you who are academics know about that transformative change layer at the very bottom there, the mental models. Let's just shift our paradigm. Let's just think about it completely differently. Both of those levels are really hard to do on their own. And so I really work in and emphasize this middle layer as the enabler of some of the other two. Understanding power dynamics and building relationships and connections. And that's something you can do today, whether online or especially those of you in the room, make a new friend, reach out to somebody, build relationships and connections, because when the time comes and when you're ready to take your second step, you'll know who to connect with, you'll know who's there. And I'm going to talk through that a little bit in a little bit more detail. So as I mentioned, this is UN General Assembly's Arts and Health Week. We've had all kinds of events. One of them was at the Guggenheim, and it was really interesting to see the dynamic of the people in the room. So there were the sort of health scientists and researchers, and there were the sort of arts people. And some people overlapped, but a lot of them didn't. And so, on the health sciences side, there were people who tend to be in the make it happen category. Planning, regulating, managing, engineering, following rules, helping us to show evidence in very prescribed and specific ways. On the art side, there were lots of let it happen people, unpredictable, uncertain, emergent, self-organizing, seeing what happens, going with your instincts and intuition. And that photo essay that was launched for the Lancet brought those two together for the very first time. Their first photo essay that they've ever had in the more than 200-year history of that publication. We need to spend more space in that middle, more time in that middle space, rather, to help it happen, negotiating, influencing, enabling, drawing on the strengths that we have from different people and at different times in our lives, different cultures, different workplaces, different organizations, right? Helping it happen in between that making it happen and letting it happen approach. In Ontario, the province where I live in Canada, I was involved in helping to support this new model for Ontario Health, which is sort of the operational arm of the health care system in the province. And it's a big new change for them to really focus on social determinants, to recognize that health care is a small part of what determines our health and well-being, and to really think in this more cyclical way about some of the different ways that we can approach this. And I'm really happy to see that they've included things like at the bottom there, listen to what matters. To people, right? To people who are at the heart of equity and health and well-being. Shift power dynamics. Remove funding barriers, right? So we're starting to think about some of those components. And again, we don't have to do it the whole thing or all of the things at once, but little pieces, little iterations, and we continue to make progress. I have been doing a lot of work on shared evaluation for lots of diverse kinds of community health interventions, large and small. And really, I focus on helping people ask themselves questions about impact in these 4 categories. People, are we making a difference for people? Are we putting that health promotion and self-determination at the center of what we're doing so that the people are empowered? Place, are we connecting people to community? Are we transferring power to community by, for example, hiring local community health workers, sharing government or health system funds with community organizations, those kinds of things? Are we helping public systems? And that really just means all those metrics that the health system already cares a lot about. The quintuple aim, right? Are we improving the population health overall, the quality of health, health efficiency, the care team's well-being, right? And health equity. And then lastly, policy, practice, learning, which really just means, are we connecting all the interest holders together when we have these conversations about what matters, what we're going to evaluate, what we want to learn and grow about, and in a learning health policy system. So the community members, the practitioners, the funders, the decision makers should be coming together early and often to decide what we collectively think matters. Instead of guessing what we think funders want to know or decision makers care about, we can just ask them, right? And likewise for participants, community members, and so on. If you want to know about more of the nuts and bolts about how we've done this kind of thing, here are two documents that you can check out. I understand you have or will have copies of the slides. You don't need to do that now. One of them is an economic analysis that I just had the opportunity to share to the Federal Reserve Bank on Wall Street here in New York this week, all about the benefits of social prescribing and related approaches for the bottom line in Canada. And what we found was for every dollar invested, there's a social return on investment in terms of reduced healthcare system costs and improved social and economic participation of $4.43. And I've also made an argument in the other paper about how this meets Canada's needs in a very changing, dynamic global environment with a new prime minister and sort of new national goals around resilient communities. Okay, so really briefly, I'm going to talk about some of the sort of personal side and things that help me carry on as an individual, as a person in doing this kind of work of trying to do systems change. One is to acknowledge and appreciate. So this is a piece of art by Christy Belcourt, a well-known Métis artist in Canada. And this is one way of saying, again, Indigenous health leaders and many communities around the world have been doing things like arts and health and social prescribing community for millennia. And researchers have been documenting this for decades. And so we have to acknowledge that while there might be some components that are innovative or a new way of thinking about it at a systems level, we are in debt to people who came before us, and we want to acknowledge and appreciate that. And as I mentioned, I'm an enthusiast, so I do spend a lot of my time acknowledging and appreciating the hard work that people are putting in wherever they are. Take up space. Okay, so this is the statue of the fearless girl facing down the New York Stock Exchange, where I was earlier this week, as I mentioned. This has been a hard one for me. And that's partly because of growing up in a culture and in a family where I wasn't socialized to take up space, right? I was meant to sort of step aside, make room for others, accept my lot in life, and so on. And it's been a constant learning journey as a feminist, as a community member, as a mother, to really take up that space and to very much with my mentees and the people I work with, encourage them to take up space because we really need you. Each one of you is bringing unique lived experience, expertise, knowledge, relationships, and all of that we really need if we want to make this systems change together. And many, many people, particularly those from marginalized communities, have been excluded or given messages that we should be taking up less space. And I'm a tall and big person, so I've internalized that in literal ways over the course of my lifetime. And I'm very much inspired by this girl who's not afraid to stare down the big boys. So here's the other side of that. So, there was a time when her statue was facing this one. This is the Charging Bull, also in the financial district here in New York. And I thought this was just kind of fun to see many, many people taking the usual view of this particular statue and wondering what it might look like to just take a different perspective and to be brave in doing that. So one of the things that can be challenging about doing work in social prescribing and social health, arts and health, is that it doesn't always get a lot of respect. And sharing authentic stories in this space doesn't always work well with people who are more accustomed to biomedical ways of knowing and doing, or economic ways of knowing and doing, and so on. So being able to embrace taking a new perspective is something that I really actually enjoy and find energizing and helps to make it fun. Break the ice. So this is a big part of what I do too, is helping people identify what are the barriers to doing the work you want to do or to making improvements, and to share my gifts and talents wherever they can help, right? And so different ones of us will be able to break ice for people in different ways. It might be helping to support people financially to participate. It might be by providing transportation, reducing transportation barriers. It might be by helping people identify and make policy changes or get funding that they really need to be able to do. And so being an icebreaker is a big part of the work that I do, and I'm share what I can, and others, will do this in their own ways as we work together to kind of make things simpler and easier for people to get through. Make your own fun. I just happened upon this artist who is a stone carver, and he was working outside of the Met Cloisters here in New York, and he was trying to just encourage other people to come and take up stone carving, which is a declining art, and was sharing how to do it. And I got to try it out on a block of stone, and it really reminded me that, again, I grew up in a really small town where this was true. We made our own fun, and you've got to make your own fun along the way and find those pieces of joy. And I know Claire encouraged you to do that throughout your day today. So make sure to make your own fun so it isn't just about being entertained, but really being engaged in meaningful and purposeful ways to find that flow. Oh, care in many directions. So this is Orla. You can see she's got this hilarious mini mohawk now in the middle of her hair. That's because she's had updated surgeries to replace that missing piece of skull. Her hair has grown in quite a bit. And she's a lot bigger because kids grow fast. And I have two other daughters, and I really didn't want to leave them out. So she has a twin sister, Erin, and an older sister, Aoife, who's the hockey player in the middle. I want to say care in many directions because giving care has been such a huge part of my life as a parent, as a mom, but also as a caregiver to my kid with brain injury, and as a wife and support with my husband in a parenting team. The other thing is, I'm going to be here in New York off and on for the whole year on a leadership fellowship of my own, working directly with the School of Leadership and Civic Engagement at the University of New York, and with arts and health leaders, including Jill Sonke, who some of you probably know, on arts prescribing here in the US. And so, although I've been giving care in many of these ways, I'm also receiving care from these three and their dad in the form of a room of my own and a little bit of space to really think and be able to do this work in new ways. And it's a little challenging for all of us. And I miss everybody, and I'm going to head back really soon in the next day or two. But this is something that they're giving to me. And I'm also in turn showing them by example how important this work is to me and how we can continue to get through this together. Okay, so that's it. I really want to encourage you to take that next step. You know intuitively already what it is, but I would be really happy to talk with any of you about it if you want to talk more about growing or systematizing what you do, if that's your next step. But it might be something else entirely. I really wish you well in taking that next step or wheeling your next wheel, or whatever that looks like for you in your body and in your life. Next slide. I'm going to stop there, but now I'm just added that you're invited and you can RSVP to the party. You can reach me at kate.mulligan@utoronto.ca. Really wish I could be there with you in person for the rest of the conference. Thank you so much for having me with you this evening here and this morning for you.
Thank you very much, Kate. Thank you so much for being with us, and despite the time difference and after I know was an extraordinary long week. All right, Kate, thank you. We'll let you go. You're welcome, of course, to linger, but I'm sure we'll connect with you on many occasions. Have a wonderful year. We will continue to be in touch with you. Thank you again.
Jimmy Witch, thank you.